Hello and welcome to International Social Prescribing Day 2021. We're delighted that you've joined us today in our webinar, which is called Self-Help UK Supports Social Prescribing. So we're celebrating today all of the work of our staff and volunteers at Self-Help UK to ensure that whether it's through becoming part of a self-help group or whether it's through accessing one-to-one befriending support, that individuals are able to get the very best in social and emotional support, which complements their medical treatment. One of the things that we're very keen on at Self-Help UK is that we are seen as a key player within social prescribing. And what we're going to show you during the webinar is a flavour of how we've managed to support social prescribing to be an integral part of it, but also because the strapline for International Social Prescribing Day this year is maintaining our communities through the global pandemic, it's also looking at how we've responded to the global pandemic and to the restrictions that that's brought with it, and how we've also responded to the needs of a group of people who have got specific needs around having long COVID. So that vast array and that developing array of symptoms that people have who've experienced the coronavirus. So I am going to introduce you to two of my colleagues that have joined us today. We've got Emma, who's our Chief Operating Officer, and she's going to be presenting to us shortly to give us an overview really of what Self-Help UK does in terms of supporting social prescribing, and also what our plans are for the future. And that includes our provision around long COVID support. And then we also have John Moore, who's one of the trustees at Self-Help UK, and he's very kindly been supporting us with our technology and is supporting us with our technology today, which is invaluable to us. So we're going to have a look at a range of perspectives, a range of things that Self-Help does, and it's going to finish with me doing a presentation on the social prescribing course. One of the things that I'm very keen on hoping that you get out of today is that our social prescribing course offer is really key to the development of our support for social prescribing mechanisms, because it encapsulates and it has fed into it all of the practical expertise which Self-Help UK has in supporting self-help groups and volunteers, making sure that link workers, for example, know they've got a tried and trusted community support base to refer people into. And it's also incorporating the academic research. So we're going to have a look at the way that Nottingham Trent University has been instrumental in authoring this course. It's the marriage of those two things, our practical experience and Nottingham Trent University's academic expertise and research skills. So I'd first of all like to hand over please to Emma Watton, and she's going to be talking about our history as regards social prescribing and a little bit about what our future plans are. So thank you, Emma.
Okay, thanks very much, Martin. So great introduction there. So I'm going to launch straight into my presentation here and give you a bit of an idea about how we're linked in at Self-Help UK. So Self-Help UK and social prescribing, we've been going for nearly 40 years now, and in a lot of ways we've been doing social prescribing for almost 40 years. Social prescribing has many of the same aims as Self-Help UK, so it's a very natural fit, and it's a very natural sort of development that we should work together and share lots of ideas. So aims, for example, like taking a holistic approach to people's well-being. We know it's not about just the clinical, the emotional, the social, the demographics, about all these things together that feed into a person's well-being. At Self-Help UK, we connect people to peer support groups. We call them self-help groups, but the language I think these days is quite interchangeable. Peer support groups and self-help groups, it means very much the same thing. And at Self-Help, we support peer support groups to offer practical and emotional support to one another within the group. We support them to be accessible and sustainable. Sometimes that sustainability can be for 30 years, sometimes it can be for 5 years. It depends what the issues are. And if the life cycle of that group is that it needs to close, we will support them with that. If it's something that needs to develop and the dynamics change, then we'll support them with that as well. There's a whole host of issues and reasons why people come together in peer support groups. And just a few examples are people living with long-term conditions, whether it's cancer, diabetes, mental health issues, dealing with isolation, complex social needs like suicide of a family member, ADHD. We support and work with over 200 groups, and there's at least that many issues in those groups. There's a vast array of peer support groups out there that we support. What's the story so far? Martin said that I'd give you a sort of brief history of how we've been involved as an organisation. I really have been involved in the conversation since about 2016. In 2017, Self-Help UK were taking the lead in the conversations in Nottingham and Nottinghamshire with the Health and Care Commissioners about the role of the voluntary community and social enterprise sector. And it's very much about being an equal partner in the design, planning and delivery of social prescribing. And I don't think we were alone initially, as people in the voluntary sector thought, well, how's it going to work? Because what seems to have been thought out is, okay, health and care can deliver the prescription, prescribe the social prescription. Then what happens? Where is that prescription, if you like, actually delivered? And that's about looking at what is out there in this voluntary sector, which is why it's sort of integral that we were involved at the start to think about that planning and how it could work. So it wasn't just a case of this is how it's prescribed, then what happens? So we've been really, really pleased and really kind of involved, pleased with our involvement in that from the early years, if you like. Another way we've been involved is our chief exec at Self-Help UK sits on the board of National Voices, which you may or may not know. It's a big organisation that strengthens the voice of patients, carers and families and the voluntary sector that works with them. There's a huge host of organisations within this. Some of the big ones are like Mind, Macmillan, Alzheimer's. And then there's organisations like ourselves that are quite small but have a lot of impact. So the fact that our CEO sits on that board means we've been very involved with the strategic approach and sort of being aware of what's coming through from government and how it's impacting charities. And we've been able to sort of shout up for peer support at that table. NHS England commissioned National Voices to do some research on the rollout of the social prescribing in relation to the VCSC sector and what kind of experience they had, which again was something that was really good to be part of. I always kind of remember the kind of quote that the outcome of that, obviously there's a lot of research and it was, yes, they're in support of it, but, and I think that but is about how does it work? Are we equal partners? So again, a really useful thing to be involved in. And kind of more on the ground, rather than the strategic level. See, Self-Help UK, we work with self-help groups. That is our core business. That is kind of what we're kind of passionate about. And as a social prescribing conversation was happening, and it's coming into the kind of public realm, there was nervousness from some groups. What did it mean? What was it? What was this big thing that was coming? And our kind of team picked up on this, and we're also, excuse me, proactive about finding out what it did mean. So they did surveys with the groups about what were some of the needs arising from this. Things like the groups were worried that might be overwhelmed. What did it mean? Were they going to have random strangers just appearing? What was the process going to be like? So as part of this work, finding out what it means to serve users and groups. Also the other side is what it means to us as workers and link workers. So the outreach and development team met with social prescribing link workers, attended team meetings and discussed like the best kind of referral mechanism. So obviously I know from the social prescribers that I've met, there's a huge amount of experience and a huge knowledge of community out there. But it's such a vast landscape in the voluntary sector of all those groups out there that it's like, why not use an organisation that has 40 years of experience of working with peer support groups. So the conversation was around, rather than people, link workers directing people direct to groups, come to Self-Help UK, and there's like a link and a buffer. And then Self-Help have been setting up and delivering training to ensure groups are supported for extra referrals and changing group dynamics, so being aware of what the impact might have. Again, as Martin touched on the start, I think it's important here to mention what we've been doing to work with peer support groups through COVID. Very proud to be part of an organisation that's continued to not only deliver, but deliver really well throughout the entire pandemic. So we've got three main parts of our project: the outreach and development team, who are the core business that support the self-help groups, the Macmillan Deaf Cancer Support Project, and the Macmillan Beyond Diagnosis Gateway Project, both of which offer one-to-one support to people living with cancer, and then moving that onwards to peer support and a longer-term support option. So that has continued. So some of these things I'm sure will be familiar to people who have done that. Okay, we have to work from home now. So what are some of the things we did to support the peer support groups? We put a lot of the resources we had online. We developed them so they were online and more accessible. Obviously, the limitations, not everyone was comfortable with the technology. So we did a lot of how-to guides, created things like how to access Zoom, how to access WhatsApp. We looked at creating some short videos about staying safe online, dealing with anxiety, and began to address all those problems that were coming up that we recognised, we saw in the national press, we saw from our groups, we saw from our own experiences, how to support people best to manage through the pandemic. The face-to-face volunteer training was adapted to be delivered online, which was really successful. We linked in with a lot of the new mutual aid groups that were popping up in the communities. So we weren't just duplicating work or working in silos. Some of our self-help groups that may have been delivering support or offering support around a particular issue like mental health suddenly found themselves, we need to get food out to our members. So that would be a case of linking them up to a mutual aid group where food was an option, for example. And peer groups included concerns around COVID-19. And I think, for example, with the deaf cancer support, you may or may not have noticed, whenever the government did a announcement on the BBC, there was never a British Sign Language used there explaining what was happening. So there's a lot of misinformation and confusion among the deaf community. So our Deaf Cancer Project coordinator addressed that by working with the peer groups to ensure they were getting correct information, getting access to support. And we also supported our volunteers to deliver support by phone rather than in person. So some huge changes, a lot of work which we'll carry on with. Also, one of the big things that came out of it was the setting up of a COVID-19 survivors peer support group. So in July 2020, Self-Help identified a gap. There was no peer support group for COVID-19 survivors. It wasn't known as long COVID now, but that's how we know it. So being Self-Help UK, our O&D team set one up. Our Survivors Facebook page now has 1,500 members and is growing daily. So far as offshoots from that work, SHUK have delivered 3 webinars in partnership with Nottingham Law School on issues that were raised by members within that group around employment, welfare and housing rights. They've supported 12 new COVID-specific groups to set up nationwide. They do COVID support groups on Zoom, smaller numbers than the Facebook page, and have done a lot of outreach support by email regarding the project. That's my alarm telling me I'm going on a bit. Do excuse me, I better speed up, moving forward and moving swiftly. So we're going to continue to expand work, so resources are open to groups nationally, like the COVID-19 Survivors Group. We're going to be affiliating with charities nationally to offer peer support training. So, for example, like where a charity like Mind might do specific training around mental health, what we could do is offer the specific peer support element. We're going to do work with national voices. So we have a voice at the strategic table. We're going to continue to work with universities, which Martin will explain a little bit more about. We're going to continue to work with social prescribing link workers, and we're going to continue to support peer support groups nationally. Why should you bother with Self-Help UK? We've got 3 figures here from a previous survey that we did. 83% of professionals reported being more informed about self-help groups because of self-help work. 95% of key members reporting feeling more confident to lead their group, and 96% of group members reported reduced isolation. We have a ton of stats like that, but I think they indicate why we can support you and why we are integral to this. Really, as my final slide, it's a bit of a call to action. Our partnership with Nottingham Trent University, again, as Martin will talk about, has strengthened our ability to create real evidence-based practice resources for social prescribing. We don't just make this stuff up. We live it, we experience it, and we evidence it. We've got big plans to become the go-to national resource centre for peer support groups. Like I said before, been doing it for years, so use our expertise. Work with Self-Help UK to understand how we can support you and your organisation to help deliver social prescribing. And finally, there's more and more resources going to be online, so watch this space.
Thanks, Emma. I think you've kind of summed up beautifully there exactly what I was expecting you to, so thank you for that. You've talked about what we do, you've talked about what we've done and what we're doing under COVID, and you talked a little bit about our plans for the future. I did realise whilst I was watching your presentation that I haven't introduced myself. That's because I do have a certain delusion of grandeur that I'm just so famous that everybody knows me. I'm Martin Cook, I'm the training manager at Self-Help UK. I'm sorry, I know lots of people in the locality, we're based in Nottingham, but I know that some people have joined us from London, for example, so apologies for that. I'm Martin. I'd just like to pick up again on some of the main points there from Emma's presentation, and it refers really back to what I said in the introduction, that our role has really been to make sure that the social prescribing link workers, who are still quite new in post, they've only been around for a couple of years, in some areas of the country that model hasn't yet been rolled out, so it's a work in progress, but it's to make sure that they and other health and social care professionals are able to tap into effective voluntary support community. And it's got to be fit for purpose. And that's where we come in, really. We've got lots of different services that we offer around supporting groups to get established, to publicise themselves, to seek funding. And we also provide training. And it is definitely a bonus. It's taken COVID to get us there, but it is a bonus that more and more of our training now is going online, whether that's through our website or through our learning platform, our VLE. It means that it's more accessible for professionals and for self-help groups from across the whole country. So we really see our role as being supportive of self-help groups, but it's about being a link with health professionals too. We are part of that link between them. So Emma's given a really succinct overview of what we do at Self-Help UK in terms of our support for social prescribing. I'm going to go on in a little while to talk about our social prescribing online course. And I think a really good way to pull those two things together is that I'm going to ask John, please, if he can run a video. It's an interview that I made recently with a GP who's practicing locally, and his name's Dr. Shivakumar. But I'll let him introduce himself and talk a little bit about his involvement with Self-Help UK.
I'm one of the GPs in East Midlands. I work across quite a few practices in Nottingham and in Derbyshire, and also currently I'm working as a sessional GP where I do 4 sessions a week in Lincolnshire practice, which is not very far from Nottingham. That is what I do at the moment.
So could you explain, please, how did you become involved personally with Self-Help UK?
I was actually wanting to do volunteering work for quite some time. So at that time I was doing the locum. So the locum work the demand for locum work went down. So that kind of opened up the opportunity for me. I just was saying to myself, maybe this is the time in my career I'll have to look into volunteering. So that is when I contacted Nottingham Volunteering Services, NVS, through their website. With my expertise, they signposted me to self-help group. And that's how I came across self-help group. And yeah, the support I got was brilliant. And I'm really, really happy to be as part of the Beyond Diagnosis team.
A key theme for this year's International Social Prescribing Day is the response of organisations to the coronavirus pandemic. The theme is looking at the way in which different organisations have responded to make sure that individuals can still access the non-clinical support that they need. And I think it will be really useful to hear from you, Doctor, about the way that your GP practice has been operating under the coronavirus restrictions.
Coronavirus has really changed the way primary care and the social services and all the social care that we deliver has changed quite dramatically. In the way that we used to traditionally see patients face to face, and that is the only way that we could address the problem. But now things has changed so much so that we are dealing with majority of the calls digitally now. So, which basically means anybody logs in a call. So we have this digital platform where everything gets logged on, and then the GP or the clinician, my colleagues, they sit there and they triage and they prioritize, and then they deliver the service. It has worked. Initially, it had its own pitfalls, but slowly every clinician is slowly getting used to it. And personally, I feel the care is getting delivered in a most appropriate, in a safe manner, and patients are getting the right care. Yes, it has got its own pitfalls, like not every problem can be dealt over the phone or over the digital platform, but nevertheless, most of them could be dealt with, and we are able to bring the patients who really are in need of care to see face to face.
Thank you. That's a really useful insight you've given us into the way that your GP practice has been operating during the coronavirus pandemic. And it really mirrors the approach that Self-Help UK have been taking. So you've described your triage system, and the individuals who've been triaged and identified as having a non-clinical need can be referred to Self-Help UK through the link workers. And our input into the process is making sure that we're still enabling groups to carry on operating during the pandemic to still offer support to the people that need it. So we've been working hard to make sure that we've got in place staff who can support the group members in getting online, in upskilling themselves in information technology. So, as you're aware, Dr. Shivakumar, Self-Help UK has been responsive to the whole issue of supporting people through the coronavirus lockdown, through supporting groups to get online, as we've already described. We've also been heavily involved in supporting people who are experiencing the symptoms of long COVID, and we have a definite national profile around this. We've been supporting people, obviously currently online, nationally through a COVID survivor group. What do you think are the benefits to individuals living with long COVID of having that self-help peer support group approach?
I think it is tremendously important. Long COVID is well documented. It is evidence-based now. We are getting more and more articles, evidence-based articles from the journals. I can imagine it can be extremely hard for the patients, particularly if they already have a comorbid conditions like cancer or chemotherapy, etc., it is even more challenging for them, not just on their physical side, but also for their mental health. It can be extremely challenging. And I think having a coordinated approach with somebody like a self-help group would greatly benefit the patients. I think psychologically for them to feel not let down or thinking maybe it is normal. Yes, it is normal, but there is help available. I think giving them that bit of reassurance, I think it will go a long way for the patients, especially for their long-term recovery.
So you've described there that there is a growing medical evidence base around this new medical condition called coronavirus. Do you think that it's important that there is also a growing peer support evidence base for people living with long COVID, which can complement the evidence from the medical research that's going on? So this is an evidence base that's being put together by the peers themselves.
Absolutely. I think, ailments like long COVID, fibromyalgia, ME, those kind of chronic conditions, I think it's more support from self-help group and other kind of social prescribing is the 80% of the work. It's 20% is painkillers and the medications and the medical team, because there is no cure for such conditions. It's purely emotional, psychological support where you guys come in. I think, filtering that message into primary care, I think that is the challenge. At the moment, we don't have that support in primary care. I think it will be a great idea to have that as a kind of a social prescribing. Even social prescribing, when it was mentioned to me, it was relatively a new term for me until you gave me the platform to go through all that coursework, and I learned quite a lot from that. But I can bet many of my colleagues are not even aware about this term called social prescribing. I think for long COVID condition, most definitely yes, social prescribing is 80% of the work. And I'm sure the patients will tremendously benefit with that.
So when we first put together our online social prescribing course, you very kindly put yourself forward as one of the testers, one of the guinea pigs for the training, if you like, to give us some feedback on that, which you kindly did. Would you like to just explain, please, what do you think are the benefits to our online social prescribing course to medical practitioners such as yourself?
Most certainly, yes. I was really intrigued or very interesting to see how the psychologist team have come together with the academic team to put the whole course. It was amazing to see how much work has gone into that. And not using a lot of medical jargons, because the moment you start using medical jargons, people lose interest. I think they try to break it down very simple way so that the general public, whoever want to come as a volunteer, can get the message. I think that's the most important thing that I would like to highlight. And yes, most definitely the volunteers, if they can have the opportunity to go through that before even they volunteer, I think they will be well informed. I mean, I was in a different position because this is my day job. So it was kind of easier for me, I can say, to go through that process. But for many who are coming from different background, with a good intention, they want to come and do the volunteering. For them, it will be a great thing to have to undergo this course. It will be an eye-opener for them.
Thank you for that, John. I saw in the chat there that people were having issues with their internet connection. I know I've been having some struggles with that this morning, and yes, this recording is going to be available as soon as possible. So we'll send out the link for that. Thank you. So I'll just explain a little bit more about Dr. Shivakumar. He approached us and put himself forward to be a volunteer for our Macmillan Beyond Diagnosis service, which supports people with social and emotional support one-to-one. And he did that during the very first lockdown last year when conditions were really strict. And I managed to pull together an induction program that was facilitated remotely. And we decided to respond to the coronavirus by maintaining the service to people living at home with cancer, but we did it through telephone or through video conferencing support. So he came to us at quite a tricky time, really, when we were adjusting to the coronavirus and the restrictions that it brought with it. And he has ever since been really helpful. He's been a great ambassador for Self-Help UK. And I think that is really part of our role at Self-Help UK. We need to flag up and we need to bang the gong, if you like, for peer support groups and for volunteers who are offering services like the ones that we offer. I was in a webinar this morning. It's been a webinar fest today. And that was to launch a report on social prescribing for mid-knots CCG. And there were some very interesting results that came out from some research that's been done around social prescribing across the whole of mid-knots. It's quite a big area, quite a big section to the north of the county of Nottinghamshire. And it was highlighting some of the things that Dr. Shivakumar was saying there. So he's a GP and he's working in a city that was really not that far behind in terms of the rollout of the social prescribing link worker role. And before he accessed our training, he didn't really know that much detail about it. So health professionals themselves aren't always aware of the detail of what social prescribing is and importantly what it isn't. But also self-help groups, those people, those volunteers who are facilitating support to their members, who will have people signposted to them and referred in by link workers, they're often not really that sure about what social prescribing is or isn't too. And it was quite a high statistic that came out of that from the mid-knots area this morning, that the volunteers in the self-help groups had heard of social prescribing, they're aware of the terminology, they didn't really know what it involved. And some of them reported feeling quite nervous about the whole social prescribing mechanism because they feared that it would overload them. They wouldn't be able to cope with getting thousands and thousands of referrals and not being able to support people the way that they needed to be. So I think we act really at Self-Help UK as an advocate for the part of the mechanism which is really vital, which is the actual non-clinical support that people are able to access. Okay, I'm going to link now, because Dr. Shivakumar did that kindly for me. He summed up some of the stuff that we've been doing at Self-Help UK during the coronavirus lockdown, but he also talked a little bit about his being a tester for the social prescribing course, which is acknowledged has helped him to understand what we mean by social prescribing. So I'm going to carry on, if you'll just bear with me, please. And I'm going to look at a presentation now, which is specifically around the social prescribing course. So if you just bear with me for a minute, please. So our social prescribing course then sits on our VLE, on our virtual learning environment. That's our e-learning platform. We do have other courses on there. So there's a generic course around supporting self-care for health professionals. which includes a look at what social prescribing is. But this course is specifically around social prescribing. And as you can see from the logos there, this was produced in partnership with Nottingham-Trent University. And as I've said before, it is really a bringing together of Self-Help UK's practical expertise alongside Nottingham-Trent University's academic and research expertise. So the School of Psychology that sits in Nottingham-Trent University has been commissioned several times to monitor and to compile reports on the rollout of different social prescribing models. So a very useful partner. There's just a short screenshot there of the course itself with the different modules, and I'll talk a little bit later about who the course is for, who it's intended for and who it's pitched at, but you can see there that it's quite comprehensive. So it looks at social prescribing from different points of view. So you've got generic modules there, 1 and 2, which is looking at social prescribing itself. It's looking at the history, the theory of social prescribing and some of the academic evidence base around that. And it also looks at the policy drivers. What was it that the NHS were doing that actually made the new way of social prescribing something that was being rolled out across the UK? Social prescription in practice then, that looks more at the process of social prescribing. So it looks at the benefits of social prescription to individuals who've got non-clinical support needs. It looks at what link workers do, and then that leads on to module 3, which looks at working with community groups. It looks at what groups make of the whole process. Module 4 is about supporting the VCSE, voluntary community and social enterprise sector, to deliver effective social prescribing. So those 2 modules are looking more at the organisations who receive the person who's been signposted or referred. So that's one thing that has been fed back to us from the people who've accessed the course, that they found it very useful in being comprehensive. When we originally scoped then the training that was already out there in terms of social prescribing, we found that there were plenty of courses for example, link workers or for GPs, but there wasn't anything out there that looked at the whole social prescribing process. And we'll come on to some of the statistics and the evidence around that a little bit later. But the pitfall of that is that if you have a professional, for example, who doesn't understand what happens to a patient, to an individual once they've made the prescription to a group, if you don't know what a group does or what it can offer or what kind of support it can offer, then that's not going to be a meaningful prescription, and that individual isn't going to access the support that they really need. So that's a big benefit of our course. Each of the modules then is broken down into various sections. So this is from the first module, and it's looking at the social cure. So that's looking at some of the evidence base around what's been done in terms of applying theory. So there's a lot of evidence there around the health benefits, physical and mental health benefits of people receiving peer support, of people actually accessing support from people who get where they're coming from because they've got a similar concern themselves. So it's what's known as the help of therapy principle. It's reciprocal. So a person can better talk to somebody comfortably and confidently who understands broadly where they're coming from because they've got similar concerns themselves. And also that they can offer the support to that person because, again, they have that common interest and that common health need. Each of the modules then has plenty of links. It has a workbook, and it has a questionnaire, and it also has a resource guide. And I've got a breakdown of the research that went into the course at the end of the presentation, but that resource guide is pretty comprehensive. It gives links to a massive amount of medical and social care literature. So Self-Help UK's input then, as Emma alluded to, comes from our 40 years expertise in supporting self-help groups and other types of peer support. So our Beyond Diagnosis Gateway support, for example, it might be about one-to-one volunteers, but it's definitely done within a peer support ethos. So the meetings of the volunteers, the group training for the volunteers, that is done through peer support meetings. So we've been facilitating social prescription a long time before the current model. It's worth noting that. I'm not being big-headed about that, but it's interesting because, again, the webinar that I was in this morning, some of the confusion around what people understand as social prescribing comes from the fact that they can't always identify that it's something completely new, which it isn't. That's the bit that people don't always understand. The social prescribing link worker role is new. That's brought a new formal structure to social prescribing, but the actual process of accessing that non-clinical peer support, that isn't new. That's been around for a long time. So we've developed an evidence base of what works well in tailored support for self-help groups. We've found what groups actually work well with. And a lot of that is really down to us having the knowledge of what works best with people who are volunteers. It's tapping into that volunteer mindset is very, very important. It's about not being too prescriptive. It's about not coming in with a finger wagging prescriptive attitude. It's about working with volunteers who are freely giving their time to do what they do in supporting people, and to work with them to make sure that they're doing that in the best way possible, that's giving those individuals the best support that they can. Nottingham Trent University's input then. Is that their team of social psychologists in the group's Identities and Health Research group have an established track record in conducting high impact work. So they worked with government, they worked with regional organisations, and they worked with local government and international partners in looking at what makes for effective social prescription. They've been involved in research and evaluation really right from the start. So one of the first of the linked worker social prescribing models to be rolled out was in the south of Nottinghamshire, in the Rushcliffe area. And that was one of the pieces of research that Nottingham Trent University was involved in right from the outset. So Dr. Neve McNamara, she is the author of the course. So we work with her on the content, but she's actually authored the course. She's done the recordings for it. She's the associate professor in the Department of Psychology. And I just thought that that was a really useful quote there. So our key message is that community and self-help groups are at the heart of the social prescribing system. The research suggests that it is the group that provides the social cure. However, often those who are extremely socially isolated need support to join groups, and that can be provided by the link worker. Our focus, therefore, is complementary to the ethos and work of Self-Help UK. So you can see how it was a natural fit, really, us working alongside Nottingham Trent University. So why was the course created? So Nottingham Trent University has consulted extensively with social prescribing stakeholders, and recently they held a seminar series, The Social Psychology of Social Prescribing, and that highlighted a knowledge gap within social prescribing stakeholders, that people again weren't clear about what exactly it is, how does the mechanism work. It also highlighted a need to understand how to follow and meet guidance on best practice in social prescribing, and a need for all stakeholders, referrers, commissioners, link workers, BCSE members, to understand opportunities and challenges faced at each stage of the social prescribing system. So it was about having that holistic perspective that I talked about earlier in terms of social prescribing, that it wasn't focused on any particular part. It was looking at the process in the round to make sure that the process is as effective as it can be for the individuals who are accessing the non-clinical support. So the intention was the gaps that we were filling with in knowledge about social prescribing were that there was a lack of clarity on what social prescribing is, and some skepticism about it too. People thinking that it was over-ambitious, or that it was pseudo-medical, or that it wasn't doing what medical input could do by itself, or whatever. The vital role played by self-help groups in the process, so that was something that needed flagging up. And that's where we really advocate at Self-Help UK for those groups. How to link in with those groups, how to refer or to signpost into them, and how to develop them, which has really always been our bread and butter. The course then, we hope, promotes an effective social prescription for individual patients. It shows how that can be achieved, develops a holistic view of the social prescribing process, and it taps into emerging evidence around effective social prescribing from ongoing research and developing peer support practice. I'll come on to that a little bit later about ongoing research. One of the real unique selling points about this course is that it's not static. So it has content in it now which is up to date, but it is intended that that course will be refreshed and it will be updated as new research becomes available through Nottingham-Trent University, and as anything that we found at Self-Help UK is working better with current social prescribing systems. So who's the course for then? It's for all social prescribing stakeholders. It's for healthcare professionals, including but not exclusively for link workers. It's for service commissioners, for them to have that holistic view of the process, and would be especially useful for them to understand the part about referring and signposting into self-help groups and how they operate, and for key members of those organisations themselves, for them to get a better understanding of how people can be referred and signposted to their services. So it's for all stakeholders. So why take the course? So some feedback given there. So from a CVS manager, it doesn't compare with any other social prescribing training. From a consultant link worker trainer, the examples of individuals' journeys through their social prescription journey really made me think. And from a link worker, we had, it's so good to see and reflect on the whole social prescribing process. So they're the key themes really that we've had through the feedback. On the one hand, that the course is comprehensive, that it covers the whole of the journey, and also that it includes the perspectives of the people at different parts in that social prescribing journey. So it's about them being able to understand how it all links together. And you can see there, and you will be able to refer back to this, as some of the evidence base which has informed the course, which is pretty extensive. So one of the first things that Nottingham-Trent University did was they looked at what was already out there in terms of theory and research. They did a massive literature review around the subject, and there was a lot of stuff there. So next steps then. So for anybody who's interested either in registering on the course or getting to know some more about it, could you please get in touch with me, Martin Cook? You can either call me, telephone me, or you can email me. If you could email me on the training@selfhelp.org.uk email, please, and then I know it's about training. So thank you for your time there. I did put into the setup for this webinar a piece about people being able to send in questions that we could answer, and fortunately all of the questions bar one that I had have, I think, been answered through the actual content of the presentations that you've seen this afternoon. There was just one about the social prescribing course. If you just bear with me, please. So this was a question from Simon, who is working with one of the London CCGs, and he wanted to know, he looked at some of the literature about our course. He wanted to know, what do we mean by the course will be refreshed, that it will be updated? I can answer that quite simply, really, Simon, that the course will be refreshed and updated on the basis of ongoing research that Nottingham-Trent University is facilitating. So they are being commissioned and have been commissioned as social prescribing is rolled out across the UK. They are working in different areas, looking at slightly different models around the social prescribing link worker role, for example, to see what works best. How does it best fit what local needs are? And so as that research and as the reports from that are pulled together, that will be used to inform and to update the course. So not only are you getting a broad perspective on what we mean by social prescribing, you're also getting something that's up to date. You're getting something that is being informed by the latest evidence. So I hope that that's useful for you. As I say, we did have some other questions, but they, as far as I can tell, have been answered by the content of the presentations this afternoon. And I can't see that we've had any other questions through the chat. I do apologise that some people have struggled with the internet connection, and thanks very much for bearing with us through that. I think we all get a bit frustrated with it. I think it's basically just all taken a hammering with everybody working from home, hasn't it? But I would like to close, please, with thanks to you for participating in the webinar. Really hope that you found it useful in having an overview of what Self-Help UK does, and in having an introduction to our online social prescribing course, which I put at the end of the presentation because I think it leads in nicely. It actually uses all the stuff that we've been doing and found has worked well in partnership with Nottingham-Trent and their theoretical perspective into actually developing a toolkit that could really carry forward social prescribing. I'd also like to thank our two colleagues today, so Emma and John. Thank you very much. And if anybody's got any other questions or queries apart from training ones, and they want to know any more about Self-Help UK, please again use the email or the telephone number that are in the presentation, and I'll get back to you as soon as I can. So thank you very much for your time, We're right there on 1457. So that's my training background. Okay, thank you very much, everybody, and have a good rest of the day.